The EAC actually has made reasonable strides with the integration agenda. We have made a lot of progress in implementation of the Common Market Protocol, which actually talks about free movement of people, free movement of goods, and movement of services within the region. We are developing the necessary infrastructure, the road network, the rail network within the region, but also there is renovation of the ports within the region. What we are seeing is an increase in the volume of trade as people are freely moving within the region. This free movement comes with a number of benefits, but also with a number of challenges. One of the biggest challenges is in health. We need to be in position to have comprehensive, accessible, affordable services across the region. We are working with the partner states experts and the ministries of health, national AIDS councils and commissions within the 5 countries. We have strong support from the US government through USAID, through the CB-HIPP project.
The Cross-Border Health Integrated Partnership Project is USAID's flagship program to support the East African community and partner states in the region to address crucial areas of concern along the corridors. The goal of CB-HIPP is to catalyze sustainable health and development that will basically address 3 key result areas. The first key result area is to ensure that key and vulnerable populations, and in particular female sex workers, men who have sex with men, people who inject drugs, migrants of range of migrants, transport workers, fisher folk, as well as young women and girls. All these populations are in need of integrated HIV and health services.
Around the border we have had challenges, specifically patients getting lost to follow-up. Addressing these clients has really been a problem, and now that we are facing the major challenge of drug-resistant TB.
In line with the focus of PEPFAR 3, CB-HIPP is going to work with health service providers and civil society, utilizing innovative technologies, including mobile technologies, to ensure that key and vulnerable populations that are on treatment are retained in care and treatment and have the necessary support they need.
We are sex workers. We have female sex workers, male sex workers, MSMs and transgenders. Thank you for identifying a gap that sex workers and the key population need help.
Seeking to address challenges that have been identified over time, and in particular around cost of services, CB-HIPP will define and develop alternative health financing models that will be tested, that are relevant and viable for key and vulnerable populations along the corridors. And these will contribute to the larger sustainable health financing discussion in the region. CB-HIPP is working closely with the East African Community Secretariat, and in particular the HIV and AIDS unit, in strengthening their leadership in transport corridor programming. CB-HIPP has provided support to develop the regional strategy addressing HIV and health programming along the transport corridors, as well as the minimum package of HIV and health services along the corridor. CB-HIPP has fully engaged with the EAC and partner states at every step of the program. CB-HIPP has conducted national entry meetings in liaison with partner state experts and the entire leadership at country level, both at the Ministry of Health and at the AIDS commissions.
We cannot succeed without engaging the leadership at all levels. Our partners, USAID, and of course our health implementing partners, we want to thank you. This project that we believe will be able to have an impact on the populations in these border districts.
The next level of engagement has included conducting site entry meetings that have brought at the table all the local government leaders and civil society.
But we also have challenges across our borders which we must confront. And one of those greatest challenges is that of HIV/AIDS. So you find that we have only one sub-county hospital here, which serves both Kenya and Uganda. The Kenyan government, the national government, brings medicine for Kenyans only. But they have forgotten we have our neighbors on the other side who also benefit from it. It's like people don't know the dynamics of the border country.
10 CB-HIPP sites around the East African Community region are learning sites. The programming that goes on in these sites will be tested, and the lessons will be packaged in a way that they can be shared with different audiences using the East African Community Knowledge Management Platform. This is going to continue building the evidence around regional transport corridor program.
This is a very, very, very important initiative that the East African community is looking at as an initial step in even building stronger and stronger partnership with the US government.